The following video shows operative video of a lower transconjunctival blepharoplasty. Viewer discretion is advised. The transconjunctival approach is an approach that is used in order to address any fat that may be herniating from the lower eyelid region. The transconjunctival approach uses an incision from inside the lower eyelid. Most of these procedures are performed under local anesthesia. The patient shown here is being done under local anesthesia with oral sedation. The first clip showed injecting the lower eyelid. Following this, retractors are placed in the lower eyelid. If you notice carefully, a corneal retractor has been placed in order to protect the cornea from any injury. The retractors elevate the lower eyelid, and an electrocautery machine is used to incise the lining of the lower eyelid. This lining is called the conjunctiva. Underneath this lining is a muscular layer of fascia. The electrocautery penetrates this as well, and layer by layer, the electrocautery is used to dissect through the subsequent layers in order to address the fat pockets. Thus far in the video, you can see a combination of electrocautery and scissor dissection in order to peel back the different layers in this area. Additional anesthesia is used in order to make sure that the patient is extremely comfortable. You can clearly see that the patient is not moving and is very comfortable during this procedure. Though the procedure has been sped up on the video shown here, the actual time per eye is approximately 20 minutes. One can clearly see the golden yellow of the fat that has been clearly dissected and is popping out of the surgical field. The fat is further anesthetized with local anesthesia prior to clamping the fat. The lower eyelid has 3 fat pockets. The fat from each of these fat pockets is clamped, and the stalk is subsequently cauterized with bipolar electrocautery. A similar procedure is performed for each of the fat pockets of the lower eyelid. Once all the fat pockets have been removed, re-examination of the wound bed is performed to make sure there is no additional herniated fat and that the wound bed is nice and dry. Having done all of this, the incision is left to heal by itself. The entire procedure takes approximately 15 to 20 minutes per eye. For both eyes, the procedure takes approximately 1 hour. Patients are able to be discharged the same day as the procedure. Patients experience approximately 7 to 8 days of bruising and swelling. However, if patients can work from home, they're able to work approximately within 24 hours. Once all the fat has been addressed and removed, the corneal protectors are removed from the patient's eyes. This type of procedure does not address any excess skin of the lower eyelid. Thank you very much for joining us for this video. If you have any questions whether this procedure is correct for you or with respect to any other procedures, please don't hesitate to call us at 281-557-3223. Authre Plastic Surgery, www.autrefacialplastics.com.